Okay, it's a little bit after 1, so we can go ahead and get started. And we will be recording today, just to let you all know. And thanks so much for joining us. My name is Lauren Ash, and I am the health educator at CSUB in Student Health Services. Today, our focus is going to be on COVID and how our county is affected by it and responding to COVID, as well as CSUB's campus response and safety measures that have been put in place. As I'm sure you have heard, the age group in California with the highest number of confirmed COVID cases is ages 18 to 49. And since this age range encompasses most CSUB students, we've partnered with Kern County Public Health to offer some insight. At the end of their presentation, our knowledgeable panelists will answer your COVID-related questions, which can be submitted through the Q&A feature at the bottom of your screen.
Welcome to all students, faculty, and staff, and the entire CSUB team, and a very special welcome to our partners at Kern County Public Health Services Department. CSUB, like many other schools, colleges, and universities, we're navigating our time through this revolution in instructional delivery while striving to maintain our priorities of health and safety and our connections to one another. And we simply would not be able to do that day in and day out without the guidance, leadership, collaboration of Kern County Public Health Services. And we look to your expertise while charting our course forward. When you speak, we listen, and we thank you for that. I also want to thank CSUB Student Health Services and ASI for working with Kern County Public Health Services to organize this important informational session. And I know all of our campus community is very, very engaged and eager to hear your wisdom today. Student Health Services has been at the forefront of our pandemic planning and response effort, and ASI, as always, listens to the concerns of our students and advocates tirelessly on their behalf. So I invite all of you to listen, apply the information that you'll learn today, and also remember that our top priority here at CSUB is always safety and health. Though there have been encouraging signs of recent, and we're very encouraged and happy to see that we're making some progress. We also want to know that we still have to remain very vigilant in our own personal responsibility to ensure the safety and, by extension, the safety of our families and communities. So in that spirit, a reminder, thank you for using your face mask. Thank you for observing social distancing. Remember, of course, washing your hands frequently and getting tested as needed is important. So like you, I'm ready to get back to campus, but first we must work together to flatten the curve. So I want to thank you for letting me warmly welcome you today, and thank you for being resilient and responsible runners. Thank you.
Thank you so much, Dr. Zelezny, for opening this webinar for us today. We are also very fortunate to have our ASI President, Vanessa Chicaiza, here to say a few words as well.
Yes, hello everyone. Thank you, Lauren. I want to start off by saying a big thank you to CSUB Student Health Services for reaching out to ASI and offering to partner with us on this important event. I would also like to recognize Brynn Carrigan and Jasmine Ochoa of Kern County Public Health, as well as our very own Erika Delamar, Chief Williamson, and Tim Ridley of the CSUB Pandemic Planning Committee for being here with us today. For all of the students watching, I would like to encourage you all to continue to practice social distancing, continue to please wear your mask, and continue to practice good hygiene. And the key word here is continue. And that is because from what I have heard, our runner family has been doing a fantastic job at adhering to the guidelines and recommendations that have been set forth. And that makes me so extremely proud because that means we can come together sooner. With that being said, I look forward to listening in today, and I hope you all have a very wonderful day. Thank you.
Thank you, Vanessa. We appreciate your representation of CSUB students. I will now turn the time over to our representative of Kern County Public Health. Today, we will hear from Assistant Director Brynn Carrigan and COVID-19 School and Daycare Liaison Jasmine Ochoa. So go ahead, Public Health.
Good afternoon, everybody. My name is Brynn Carrigan. I'm the Assistant Director of Kern County Public Health Services. And a fun fact about me is that I am Roadrunner alumni, class of 2006. Thank you for joining us this afternoon to talk about a current issue of significant importance. I am sure you're all tired of hearing about coronavirus, as it seems to be one of the only topics covered by media for the past 6 months. However, a typical college student age group plays probably the most important role in the control of the transmission of this disease. And let me just repeat that because it is so important. The typical college age student group plays probably the most important role in the control of the transmission of this disease. I'm going to get into a little bit more details about what the virus looks like here locally, what that typical college student age group looks like in coronavirus, nationwide, statewide, and here in Kern, and then why we feel that that age group probably plays the most important role in the control of this disease. So let's start by talking about what COVID looks like here in Kern County. If you give me 1 second, I'm going to share my screen and I'm going to pull up Kern County Public Health's website. So I'm hoping you can all see this, and I'm hoping that you've actually been to this website before. It's going to be a vital piece of information for you to keep abreast of the information about COVID here locally. So this is what our dashboard looks like, and it really shows you what COVID looks like currently in Kern County. So today we announced 63 new COVID cases here in Kern County. That number is relatively low to some of our previous daily cases that we've announced. That brings our total to 31,572 cases here in Kern County. And these lines on this graph actually play a significant role in explaining what that disease looks like here in Kern County. So this white line shows our cumulative test, our cumulative resident cases. As you can see, this line is always going to go up. It's never going to go down. But this green line on this chart represents our active cases. And when people talk about flattening the curve, they're referring to active cases. And so when you start to see the number of active cases go down, that is essentially what we're referring to when we say flattening the curve. And so you can see this is more recent cases that we've reported. You can see that there is some downturn in our active cases, which is significant for us. I mean, it shows that there is less transmission of this disease here in Kern County. However, we still have a ways to go to completely curb this disease here locally. We currently have 12,598 active cases, which is still quite a bit of active cases here in Kern. And unfortunately, we've seen 354 deaths right here in Kern County, all related to COVID-19. So this is a significant disease. And again, I encourage you to use our website as a tool. We have multiple different tabs on our website that have the different information. This is the chart that I previously had on the screen for you guys, but it shows COVID-19 in Kern County from its beginning to where it is currently. And you can see the significant curve and the downturn in that curve of our active cases. So this really paints a picture of what COVID has done here in Kern County. I'm going to stop sharing my screen. Okay. So now that we know what COVID looks like here in Kern County, I wanted to talk about some relevant statistics that are related to the most common college-age student groups. So I'm going to share my screen once again, just so that you have something visual to look at as I'm presenting. Give me one moment. Okay. And so hopefully you can see my screen, and this is what COVID looks like broken down by age groups nationwide in the United States. So we have the cases here that are illustrated in the red, and we have the deaths that are illustrated in the blue. My focus is going to be on the red. And so you see that nationally, people aged 18 to 29 years comprise 23.3% of all COVID cases in the United States, which is the largest proportion of any age group. It exceeds all other age groups within the cases nationwide. The next slide, and I apologize for how small it is, shows demographics for the cases in California. Here's the age groups that I'm referring to, and you see that age group of 18 to 49 years is 60% of the cases. But that age group only comprises 43.5% of our population. So you'll see that this age group is much more impacted by COVID than they represent the population of California. So that's significant for us to realize. And then I wanted to talk a little bit about COVID in Kern County. We did talk a little bit about what our current cases look like, but it's also broken down by age group on our website. And locally, you'll see that the age group of 18 to 49 is significantly impacted by COVID here in Kern County, much more significantly than any other age group, exponentially. So we have 62% of our cases are represented in the 18 to 49 age group. So I'm going to stop sharing. So while this age group makes up the highest proportion of COVID cases, what's important to realize is the severity of the illness that age group is impacted by is not often as high as it is for other age groups. However, there is a real risk in the younger people and our college age people bringing this illness home and giving it to older relatives who are at higher risk for severe illness. CDC has information on how much increased risk older groups are at needing to be hospitalized and dying when compared to that 18 to 29 year age group. So I'm going to share my screen one more time. This will be the last time, I promise. And I have a little chart from the CDC that I just wanted to share with you guys while I go through this. Okay. So this chart, while it may be confusing, has the age groups across the top, and then there's the hospitalization category and the death category, and it's all compared to the 18 to 29 year age group. So when you compare the rate at which 30 to 39-year-olds are hospitalized to the rate at which 18 to 29-year-olds are hospitalized, it's 2 times higher. When you make that same comparison, but with the age group of 40 to 49, you're at 3 times higher than that 18 to 29 age group. When you look at the 50 to 64-year-old age group, you're 4 times more likely to be hospitalized than that 18 to 29 year age group. Going up to the 65 to 74 year age group, you're 5 times more likely to be hospitalized because of COVID than that 18 to 29 year age group. And then finally, the 75 to 84 year age group is 8 times more likely to be hospitalized due to COVID than that 18 to 29 year age group. Now, when you look at that same sort of comparison, but for deaths, the statistics are even more startling. So you have the 30 to 39 year age group, they're 4 times more likely to die from COVID-19 than that 18 to 29 year age group. When you look at the 40 to 49 year olds, they're 10 times more likely to die of COVID-19 than the 18 to 29 year age group. And then the same thing, the 50 to 64 year age group, you're 30 times more likely to die. That 65 to 74 year age group is 90 times more likely to die. And then finally, that 75 to 84 year age group is 220 times more likely to die from COVID-19 than the 18 to 29 year age group. And I think there's one, yes, sorry, my cameras were covering. The 85 plus age group, you'll see is 630 times more likely to die from COVID-19 than that 18 to 29 year age group. And unfortunately, as you saw that a majority of our cases are in that 18 to 29 year age group, the other individuals are oftentimes getting COVID-19 from that age group. So that's of significant importance to keep in mind. It's also important to note that there are 64 million Americans that live in multi-generational households, meaning that 20% of the American population lives with multi-generations under one roof, which plays an important role in that risk of hospitalization and that risk of death in those different age categories. A recent pre-published research has shown that secondary transmission, or somebody giving COVID to somebody else, often occurs more often in a household with close contacts than in non-household contacts, meaning that when you have COVID, you're more likely to give it to those individuals that live within your household than you are to give it to people that you just cross paths with when you're out and about in the community. It is in these most comfortable and vulnerable situations that we're seeing the transmission of COVID-19 occur the most often. It's within the home that we're seeing it occur the most often. It's within a place of business, but during a lunch break, not when you are actually out, if you're a cashier in retail, or if you're working in the food industry. While you're working, you're practicing those preventative measures. You're wearing a mask, you're practicing hand hygiene. However, you go into the break room, you let your guard down, you take your mask off, and then you actually engage in the most dangerous, as far as transmission is concerned, activity, which is eating. When you're eating, it's very easy for those respiratory droplets to transmit, to come out of your mouth. And unfortunately, this is gross to think about, land on somebody else's food and then they ingest it. And therefore you transmit COVID. And then the final area where we see transmission most commonly occur is when you're just hanging out with your friends and you let your guard down and you don't wear a mask because you're at your friend's house and you see your friend all the time. What's important to note is that in California, our governor has tied our case rate and testing positivity, which represents disease transmission within our community, to the ability for our economy to reopen and for our schools, including CSUB, to provide in-person instruction. So even if you feel like you may not be at risk for severe illness from COVID-19 and you don't share a household with a higher risk individual, we all have a responsibility to control the transmission of this disease until a vaccine is available, so that we can get our economy back reopened and our children and our college students back into the classroom. Because COVID is considered a novel disease, information and guidance changes often and quickly. For the most up-to-date and accurate information, please visit our website, which I had on the screen earlier. It's kernpublichealth.com. We have an entire page dedicated to COVID-19, the most current guidance, the most current rules, and then also our dashboards on there where you can stay abreast of what COVID looks like right here in Kern County. With that being said, I think that concludes my presentation.
Thank you, Brynn. Before we begin the question and answer portion of this webinar, UPD Chief Martin Williamson will introduce our campus representatives from the EOC and the Pandemic Planning Committee.
Thank you, Lauren. Good afternoon, everybody. Just as a kind of a informational thing, in this case, even though my title is still chief, I'm really acting as an emergency manager for this. We started, just a quick history, we started planning, unfortunately, for this virus back in February as a campus, and have been working, the teams have been working behind the scenes dramatically and for a lot of long hours since then. And our goal was to provide the safest campus we can, keep everybody safe and provide a safe campus, but at the same time, have the planning available for the response, mitigation, and to stop the spread of a virus if it comes to it. So with that, we activated the we activated our emergency response level and activated our emergency response team. But we've had many teams from all over the campus. So it's not just the three of us that are here today representing the pandemic planning team or the emergency response team. There's probably about 20 of us that have been involved in this for months and months and months. But today with me is Tim Ridley from our safety and risk management, and as earlier mentioned, Erika from the Student Health Center. We're all in contact, and there's been a lot of meetings behind the scenes, and we'll continue to do that to be able to provide the safest campus. And again, as President Zelezny mentioned, thanks to Kern County Public Health, probably Jasmine's getting tired of hearing from me. She's our local contact, but they've been a great resource for us, and we're working hand in hand with them to keep our campus safe. So thanks, Lauren. I appreciate it.
All right. Thank you, Marty. My name is Jessica Allred. I'm a clinical assistant at CSUB Student Health Services. I am going to be facilitating the question and answer portion of our meeting. To ask a question, go ahead and utilize the Q&A feature at the bottom of your screen. I will read aloud the questions in the order they're received and direct them towards panelists whose position offers the most expertise on each subject. We will start by answering one question per attendee. If time permits, we will try to answer attendees' additional questions towards the end. Please notate your top priority question if you submit multiple questions so we can make sure it is answered live. If we do not answer your question live, please consult the chat panel for answers. In some cases, you may be asked to submit your name and email address for a follow-up conversation with one of our panelists. We remind attendees to please keep questions focused to COVID-related topics. And let's get started. So this question is for Kern County Public Health. What are the first symptoms of COVID?
Symptoms vary, and in fact, there are times where you have no symptoms at all, and that's called asymptomatic. However, oftentimes, if you are symptomatic, it'll be associated with a fever that's 100.4 or above, and then respiratory-like symptoms, a cough, that sort of thing. What we're hearing is the most common symptom is actually a loss of taste. So a lot of our positive individuals indicate that they noticed that there was something wrong because they can no longer taste food that they put in their mouth. And we're seeing that as a recurring symptom. There's also some of the more flu-like symptoms like diarrhea that are also associated with it. But again, at times there are no symptoms associated with being positive for COVID-19.
All right, so it's definitely case-by-case basis, unfortunately. All right, another one for Kern County Public Health. This one comes from social media. How can we tell the difference between COVID-19 symptoms and bad air quality symptoms?
So again, I guess I would go back to the fever. Oftentimes people think they just have allergies or it is just the bad air. I would never just make that assumption and then go about my business. If you're feeling under the weather at all, we recommend that you stay home, even if it's just a cough or you think that it may be allergies, because it could definitely be COVID-19. And we are still learning a lot about COVID-19. So there could also be some other symptoms out there that maybe we aren't aware of. So anytime you're feeling at all under the weather, stay home, look for that fever. And if at all you're in question, go and get tested. That's the only foolproof way.
All right, this question is for Marty. It is from social media. It says, when we return to a college setting, what should be the expectations to prevent the spread of COVID-19?
Great question. And again, I wish I had a good answer. I don't know if we really know what it's going to look like when we return. I think it all depends upon where we're at that point. Is there a vaccine? Is there not a vaccine? Again, but maybe I can refer it this way. Even though we're talking about COVID right now, what we're talking about, other than wearing a face mask all the time, can also help us prevent other types of diseases, communicable diseases, or flus and all that. We're coming into a tough flu season. So again, I wish I could answer what it's going to look like in the future, but we don't know. I don't know if Brynn or Jasmine has anything, but we don't know because we don't know when the vaccines are going to come out. We don't know if this is going to morph into anything else. I mean, they're out there looking at it, but at this point, we're just hoping that if we return back, and I'll speak on behalf of the president and the chancellor, we're not going to return back until we can provide a safe campus for our students, staff, and faculty. And so we're going to have to rely on science, on public health, vaccines, and all of that. So I wish I had a good answer to it, but I don't think there's one there at this point in time.
Perfect. Thank you. All right. Another one for Kern County Public Health. You guys are super popular. This one is just asked. It says, why do we track our age groups differently than the national categories? Our age group, it looks like it's 18 to 49, when some other age groups categorize it as like 40 to 49, a little bit more small.
Yes, the difficult thing is it seems that every agency is tracking their age groups or just basically their demographics differently in different categories. What we always do is we reference California Department of Public Health, and however they are representing their age groups or their demographic categories, we try to mirror that so at least we match what the state is doing.
Perfect. All right, another one for Kern County Public Health. This one was from another anonymous from right now. How does a population of incarcerated people affect the statistics on infection and death in Kern County?
That is actually a very good question. So the incarcerated individuals, this does not include those staff that work in the correctional facilities. Prisoners themselves are included in Kern County Public Health's dashboard, so they are represented in our local numbers. However, at the state, when they're looking at our metrics to reopen, prisoner population is excluded from those data categories, but we do still track them on our dashboard. There are some significant COVID outbreaks within our local correctional institutions, so we do work closely with the medical staff at each of those institutions to try to control those outbreaks. However, they do not count against us towards our metrics for reopening.
Perfect, thank you. All right, we have one for Vanessa. This one comes from Spencer Shepard. He says, is there a link for the recording of this meeting?
Yes, a link will be shared on our ASI Instagram.
Perfect. We'll also share it on CSUB SHS social media as well. There is a question, either President Zelezny or Marty can answer this question. The question comes from Karen. Oh, nope, not from Karen. I'm so sorry. It's come from Denoria. She says, what does this mean for the commencement 2021? Will there be a graduation ceremony or will an alternate option be presented?
Thanks for the great question, and I'll take that. We are still going to remain cautiously optimistic about our ceremonies. What we do know is that at this time, we can't make any decisions about dates moving forward until the governor and our Kern County Public Health give us a go-ahead for mass gatherings. And at this time, we're just going to remain cautiously optimistic, again, not knowing when the vaccine will be available. But you can bet that we're all ready to celebrate. And what this means is that we not only have plans, and so I want to let you know that we're not just standing by and hoping, but we have plans as soon as we get that go ahead. And it won't just be one commencement ceremony. We'll have graduates from 2020, spring 2020, and also our graduates in December, and also our graduates in 2021 of spring that we'll be needing to consider to make sure that we're doing those celebrations. What we're hearing from students is that students want an in-person walk across the stage in front of their families and their friends. And so we're hearing that strongly from students. If you feel differently about it, please do share that input, especially with ASI, because they keep me apprised of what students' values are in terms of those celebrations. So stay tuned. You should, however, apply for graduation regardless of what we know now about ceremonies. So those are two different applications, and make sure you don't miss the opportunity to graduate, and we'll get those celebrations in place just as fast as we can. Thanks for the good question.
Perfect. Okay, I have another one for either President Zelezny or for Marty. It says, what is happening at CSUB AV campus?
I can handle that. We have a liaison with the AV campus, so that way The dean is on our campus preparedness council, so she is very, very much aware of what's going on. But also as part of the emergency response team, we have Ben Perlato is a liaison with Antelope Valley. So they get the same information we do, but they're not as actively involved because you have to remember that they're on another campus and they fall under LA County, not Kern County. So we're sensitive to there's a difference, but at the same time, we're trying to make them as inclusive as we can and keep them aware of what's going on the CSUB Bakersfield campus, but knowing that they're in a little bit different area down there, and then we'll respond accordingly whenever we can help.
Perfect. Thank you. All right. This one is for Erika Delamar. It comes from John. He says, how many CSUB staff and students do we know have tested positive? How many have been hospitalized?
It's a good question. So we only know what has been reported, but we do have, I will share my screen, very similar to Kern County, a little different, but we actually created a dashboard for campus. And it is off of the COVID-19 alert page. So if you go to the COVID-19 alert page, you will see it says CSUB dashboard. So I will be changing this tomorrow. We report every Tuesday to the chancellor's office. So that's what we've stayed consistent and updating this website then every Tuesday. So then that will read from the 15th to the 21st starting tomorrow. But we have had a total of 20 positive reported cases. Of those, 17 were off campus. So we do encourage, even if you are off campus, to make that report. And it may be if your staff and faculty, there may be means in terms of leave or things that might be afforded to you depending on what's going on. If your students, you're still attending virtual classes, and if you need accommodations or if you're missing class due to that, we want to be able to help you. We did have 3 reported on-campus cases, and if you guys were watching your emails, they went out. We did our clearing notices on those. And currently, of the 20, 19 of them are recovered. So we only have 1 active case that we're aware of. Obviously, we only get what we are reported in terms of that. So that's probably one of the biggest ones, as I would say, is to look at our reporting policy, what we do request that you report, because it is a means for case management to assist you. So I don't want you to think if just because you were off campus, we wouldn't want you to report that. We would, in fact, want you to report that to us.
All right, the next question is for Marty. What is the campus response when a disabled person is unable to wear a mask, like their disability doesn't allow them to wear a mask? Are they still allowed to be on campus and not wear a mask, or what's the protocol for that?
We do have a protocol, but Tim's area has been tasked with the face coverings. So I think it'd be better suited, Tim, if you want to take that, please.
Yeah, certainly we would accommodate. There are other venues that they can do for protection of themselves and others, including wearing a face shield is acceptable when we know that there's a medical condition that precludes someone from wearing a normal face covering. They can certainly wear the face shield, and that would be acceptable.
Perfect. Thank you. Okay, Marty, this one is for you. If the number of cases in Kern County continues to trend downward, how will this affect spring classes?
Not much as far as the instructional. The chancellor has already come out with the directive that we will be staying virtual with distance learning for the remainder of this academic year. And to my understanding, and certainly the president can correct me, but at this point, we're going to stay a status quo with the number of classes, and we're going to try to target the same number of students that are able to come on campus along with essential staff. So because the chancellor had to get out in front of this early so everybody could plan both for academics and all the other things that have to be planned far ahead of time, the chancellor has taken the err on the side of safety and caution and has put it and is going to keep the CSU virtual. So therefore, other than maybe some very, very minor things, we're going to stay status quo through at least May, the end of May, or May 24th, I believe, is our target date for that.
I'll corroborate that information. Again, we're following the chancellor's guidance, and he follows the governor's guidance, and then all of us follow our regional public health.
Okay, this one is for Erika. Are students going to be required to get the vaccine?
So I will tell you, we have not heard anything coming from the chancellor's office at this time regarding a requirement. I would say we would strongly recommend it when the vaccine does come out. With that, I will put a plug in very much like Brynn. We are strongly encouraging the flu vaccine this year. We will be offering that as well here at the Student Health Services. And we normally would say a little bit later, but this year they're recommending like now. So we would say if you have the means to get it, or if you want to call the Student Health Services, we can tell you about the process for the flu vaccine as well too.
Okay, this one
that is also free. I want to make sure that students know that that's a free service and to take advantage of it. I myself have already had my flu shot, so I encourage you as well.
All right, President Zelezny, stay unmuted. This one's for you. It's from Caleb Cortez. He says, in spite of the pandemic, what positive outlook is there for fall 2020 graduates as far as possible options for commencement in December?
Well, we won't be able to have a face-to-face commencement in December, Caleb. And again, what we're having to do is postpone. We're not canceling, we're postponing your celebration. And this is so that we can make sure to maximize the dream that you had of graduation. And we'll look forward to celebrating. I know it will feel perhaps like a reunion because it won't be on an exact date that we can declare right now. But rest assured, we are trying to be very cautiously optimistic and look forward to those celebration times.
Okay, this next question is also for President Zelezny or possibly Marty. I know that due to COVID, a lot of things are backed up, such as financial aid. Do you guys have any information on that?
Well, I'll answer that. I don't know if Dr. Dwayne Cantrell is on, but if he is, he can put his email information in the chat. And I know that we are working as hard as we can to get your phone calls in financial aid. Continue to be persistent. Because again, many of you, your financial aid status has changed because of COVID. We want to make sure that you're getting the maximum amount of financial aid that you're eligible for. So continue to be patient with us. And again, Dr. Cantrell, if you are on, or if our provost is on, he can share that financial aid information for you.
Okay, this one is for Kern County Public Health. It says, why is guidance still suggesting 6 feet of separation, information, and illustrations, even though droplets can generally spread much further?
So we go off of what Centers for Disease Control and California Department of Public Health state. And they have indicated that while droplets can spread much farther, within that 6 feet of range, you're more likely to be impacted by transmission of the disease. Again, that's probably why face coverings are also required, so that even if you are outside of that 6 foot different distance, if you are coming in contact with other individuals, even at greater than 6 foot distance, you could still potentially be at risk. But with the face covering, with hand hygiene, you are protecting yourself still.
Okay, so this one is for Tim or for Marty. It says, how will CSUB adjust based on updated county recommendations regarding in-person gatherings, fitness settings, classrooms, etc., when the guidelines start to change? Will campus offer outdoor programs or services like some of the county is, or continue to advocate for no one being on campus at all?
I can start with an overview. Again, I think we have to, kind of like the prior question is, I think we have to take kind of a wait and see approach. We will not bring anybody back on campus if we can't pretty much guarantee their safety. And I know there's a lot of people that would like to get into the student rec center. We want people back. But again, that's why we're working so close with County Public Health, is as our numbers allow us to, and the science allows us to, depending on whether there's a vaccine or not, then we will look at each segment of the campus, and at least the EOC team or the emergency ops team will look at it. There's a process in place that we also visit with the campus preparedness team, and there's a lot of things that are discussed in a very open setting before it gets to the president. She's certainly included in it, but the president is very active in a lot of the discussions. But we look at all those different avenues. But again, I think it's easy to say that it boils down to we have to provide for the safest opportunities for our students, and we will not sacrifice that just to open something up prematurely. And that's why public health is such a great partner, because they give us that guidance, and then they follow the state, and then and such has been said with the chancellor's office. I'm not sure if anybody has anything else to add on that.
Thanks for your patience, and we all look forward to using those facilities. But for now, our guidance from the CSU chancellor is to hold.
Thank you. We're getting a lot of really good questions today. Thank you guys for asking and participating. We really appreciate it. The next one is going to be for Tim. It's, what are staff's obligations when they see someone on campus not wearing a mask? What if the staff offers them a mask and they refuse?
Yeah, if in the unlikely event that a student is offered a mask and says, no, I don't think I want to do that, then the professor can simply contact the Office of Safety and Risk Management, and we will send someone over to deal with the situation to resolve it as best we can. There are protocols in place that have been approved, but I'm very, very proud to say that no one has called upon us yet to deal with that situation. And that's just, it says so much about the staff and faculty and the student population at CSUB, that they understand the need for this, and that it's not an unreasonable request while we're in a public building to follow the governor's mandate. And it is a mandate from the governor's office. We are a state entity. We are state employees. We're going to a state educational system. So it is required, it is mandated that all of us who participate in CSUB face-to-face classes do wear the face coverings as prescribed.
Perfect. This next one is for President Zelezny or Marty. If a vaccine does come during spring term, are students, faculty, and/or staff allowed on campus, although the classes will remain virtual?
Well, those are scenarios that we'll plan for, and what we're doing is, again, we're really following the science of what it's likely to look like in the spring. There are some forecasts that we've heard that make me feel a bit cautious. So that's one of the reasons that it's important to have right direction and decreasing. There is some forecasting that is rather concerning in the spring. But back to your question about a vaccine, again, predictions from the CDC are saying maybe the second or third quarter of the new year coming up. And so what that tells me is that we'll be almost completed with our academic year by the time we know that we have a viable vaccine. And then the next thing is, what is the availability of it for mass dissemination? So there's a couple of things that we need to get markers on. Again, the United States is really got efforts put forward to get a vaccine. We all want that vaccine available, and one that will be effective and that we'll have availability to in mass distribution. So there's still a lot of what ifs, but the plans for repopulation are ones that the campus preparedness team is working on, and what that might look like. So I think for now, the the thing that we can say is that until we know that we've got vaccines available, we'll be continuing as predicted by Chancellor White. And I want to remind you, Chancellor White doesn't take these science decisions lightly. He himself is a PhD in health science, so he understands the science and listens to the forecasting, and thereby made his decision for the entire CSU. So it's a great question. There's a lot of hope, and I'm going to hold on to the hope too. But again, it'll have to be a very planned, phased in, to make sure that we're doing it wisely and that we are prioritizing health and safety.
Okay, awesome. This question is for Kern County Public Health. LA County seems to be relaxing large group guidelines specifically to speed up the return of team sports. Can we expect the same to happen in Kern County?
All of our guidance that we have here in Kern County is all based on state issued guidance and where we fall as far as what the state has said can reopen or resume within our county. Unfortunately, at this time, the state as a whole has not allowed youth sports to begin outside of just conditioning and practicing. And the same has been said for amateur sports. There's no guidance that has been released for that. And so until the state issues guidance on that or tells counties that will be allowable, the county is not going to take a step further than what the state has allowed within our county.
Can I just add that Dr. Ziggy is also part of our response team and also the pandemic planning. And so he and President Zelezny are very actively involved with the Big West and the NC2A to make sure that as they move forward and provide guidelines, that number one, it coincides with our local guidelines and our state guidelines, but at the same time trying to promote the student athletic competition at our level. So it's certainly related to everything else, but it's kind of a separate in the way that they're going, and CSUB is well represented as those guidelines are being developed.
We just had a comment from Janice Clausen from Services for Students with Disabilities. She wants to respond to Tim's response that he gave earlier regarding disabilities, students with disabilities and masks. She says, if a faculty, staff, or student has a disability-related reason for not wearing a mask, they must be allowed to bring their request to the appropriate area, either the Services for Students with Disabilities, HR, places like that. We provide them an opportunity for an interactive discussion with the appropriate area per ADA and other applicable disability laws. So if you have any more questions about that, we can direct them to Tim, or to Janice. This next one is for Dr. Zelezny. His name is D. Wu, and he says, as we continue to be virtual in spring 2021, will there be any change to our spring break?
Oh, Professor Wu, thank you so much for your amazing work at CSUB, and we thank you so much for the question. No change in spring break. Spring break will continue. It'll be well deserved by students, faculty, and staff.
Okay, this one is for Erika. It says, will there be COVID-19 testing available at the Student Health Center at CSUB?
I'll share this with Marty a little bit when we're done here too. At this time, we had received guidance that from the Chancellor's office to not have testing at the Student Health Services. And so we don't currently. If that guidance were to change, we do have the capability to do so though.
And I will add that we're working on the feasibility of maybe trying to bring in some COVID testing onto our campus free of charge. Again, it goes back to our relationship with public health and our colleagues up there. And I'm going to I'm pulling off a favor here and wishing Brynn a happy birthday today. You'll know where that came from, Brynn, but I've been texted, so I wanted to carry that out. But on the serious note, hopefully within the next several days, you will hear whether or not we will be able to provide free testing. It will not be through the health center. It'll be through an outside provider. But if we can pull it off, then we're looking at the feasibility of bringing in an outside provider through Kern County Public Health and a mobile testing center that'll provide services to not only the campus but to the community itself.
All right, this next question is for the birthday girl. It's from Marlene Hensley. She says, are percent of infected and deaths per population posted on the website?
Good question. They are not currently posted on the website. We're completely open to suggestions on what should be added to our website because we want it to be very useful information for our community. So I'll definitely take that down as a note and talk about it with our team and see how feasible it is to add that information.
Okay, this next one is for either President Zelezny or for Marty. And this one comes from Becky Lappin. It says, daily I see multiple people walking through campus, exercising without masks on. They will walk right by me if I allow them to. I do not allow it. My mask and I make a big detour around them. Is there anything that can be done about that?
I'm going to let the chief take that because he's been very proactive on our industry standard on that.
Thanks, Dr. Zelezny. Yes, we have reposted some signs trying to warn the public. And I will say they're a little bit clearer and maybe a little bit more stronger that we are trying to deter the general public from coming onto campus because of that very reason. We do not allow our non-essential staff to come on campus or our students. So we're trying to push that to the public. So if it's a very flagrant or type situation, you can always call UPD. However, we're hoping to do it by education and asking for voluntary compliance in order to get everybody educated and hope that they will deter using our campus, at least for the time being. We appreciate everybody coming to our campus. It's a very beautiful campus. It's great to walk on, but we're in different times right now. And so we're looking at different ways to handle this. So yes, we put out additional signs and hope that the education part will deter it. But if it's something really flagrant, please don't hesitate to call UPD and we'll see what we can do to educate and get cooperation from anybody that's on our campus.
It looks like there was another question that came in that was along the same line. So Marty, if you have any other comments, feel free to chime in. It says, despite the continuous communication to students, faculty, and staff about not going to campus, there are plenty of people that walk the campus both on the weekday and on the weekends, many of which do not wear face masks. How can we encourage students not to come to campus if we see this going on?
I think that we continue to try to educate and promote the need for people to try to avoid campus if there's not a real need to be here. It's all about education and changing what we do on a normal basis, and that's hard for a lot of people, but we have to strive to continue to do that. This is not going to get completed by us going out and telling one or two people. It's got to be a bigger, more global response to it. So if we have to, we can put out more signs. We're looking at putting out some more public service announcements to remind our students, staff, and faculty to stay off campus if you don't need to. We get it that there's business that has to be done, but at the same time, we have to try to protect everybody, and that goes along with the public too.
And maybe I'll add here just quickly, I am very, very proud of students, faculty, and staff that know our protocols to come to campus, and this includes me. If you come to campus, there needs to be an assessment that is done prior to coming to campus, and you need to be given the clear on your cell phone within a text that says you're allowed to come to campus. Otherwise, you are respectfully requested not to come to campus because you have some indicators that suggest that you need to stay at home. So thank you, Erika, for being so responsible for those assessments, and those assessments are in the hundreds every day. So I really do appreciate all students, faculty, and staff who are taking part in coming to campus only after you take that pre-assessment.
So we want to thank our panelists so much. We have really appreciated all of your answers, encouraging us to stay responsible runners and to help the campus stay safe and healthy. I'm going to go ahead and pass it off to Kern County Public Health. We have this last question, and then if you guys wouldn't mind wrapping it up for us. The last question is, if and when the vaccine is available, will it be used for those who are most at risk first, or the youth? Who will it be used for?
That's a good question, and that's something we don't have the answer for yet because we don't know how much we will be allocated to actually give to our community. Of course, if we're given the vaccine in very limited quantities, our first and foremost will be to get it out to those that are most vulnerable for severe illness and death from this disease. However, if we get, enough to cover the entire population, then we strategically set up our clinics to try to get the vaccine into as many people as we possibly can, as fast as we possibly can. So it all depends on how much we get allocated. With that being said, I want to thank everybody for spending their hour with us today. It means a lot. I'm sure it means a lot to CSUB. It means a lot to us at Kern County Public Health that you want to learn more and you want to be proactive in Kern County's fight against COVID-19. As a community, like I showed you on the graphs, we are lessening the spread of COVID-19 in Kern County. And I think it has a lot to do with the couple of you on this webinar that actually are trying to enforce masking throughout our community. We appreciate people like you. We all may be tired of hearing about the same prevention methods over and over and over again, but they're so crucial in our ability to continue to decrease COVID-19 transmission in our community, to saving our vulnerable population and their lives, and reopening our economy, as well as preventing any other respiratory communicable disease, such as the flu, which is right around the corner. So please, please, please wear a mask when you're in public. Wash your hands often, stay home when you're sick, and avoid gatherings of people outside your household. Thank you again for your time and attention. It's been a pleasure.
And we did have one last thing. We had a couple of questions that we didn't get to. So like we said at the beginning, we've got your name and we can reach out to you. Or if you didn't include your name, or if you have another question, you can send it to us, and so that we can contact you and answer it for you after this. So thank you again, everyone, for attending, and I hope you learned a lot.